Well, thank you. Welcome. Thanks for coming here and listening today. I will start and preface, and Laura, thanks for the introduction. I will preface a few things. One is I'm definitely not an attorney, and definitely not an ERISA attorney, and not an accountant either, because there, some questions that may come up maybe get way beyond my scope from a legal perspective or from a tax perspective, but I do appreciate it. So what we really wanted to cover today is we just want to understand a very brief overview of association health plans, which I'm sure many of you have some experience with, a lot of experience with, or maybe even little experience with. Why the associated health plans could be at risk right now, and I say could be because with anything, things do change. And how can give you some options about how to keep competitive with benefits, and then explain a little bit about our company and what a professional employer organization is and what we can potentially offer in relation to solving problems for small businesses. All right, so just very brief about Axios. We've been in business for 31 years. We are a human resource company. We help businesses attract, retain, and develop their workforces. And we started in the employment world, so we did staffing and grew very large staffing side of the business, which meant we had a very large internal payroll, workers' compensation, benefit admin, tax compliance, that type of thing, and said, why don't we take this and go to other small businesses and see if they would need these services as well. So we opened up our professional employer arm of our business, which is the HR outsourcing arm of the business. We've been doing that since early 2000s. And then we also have a insurance arm of our business. So with employee benefits, we have a lot of employees that we are co-employed with, so we offer and manage all of their benefits. As the slide shows, we have over 18,000 people that we pay annually. We usually help between 3,000 and 4,000 people a year find permanent work in our markets that we're in, so we feel great about that. And we provide benefits to around 8,000 people or so. Anyway, so that's just a little bit about us. So association health plans. So originally, association health plans were the idea of taking very small sole proprietors and very small businesses together and pooling them all together to get some buying power from a benefit perspective. They've been around for a while. I think they've gone through the ages where some have worked well and some haven't worked well. Some at one point would be self-insured, and most now are fully insured plans. The self-insured piece, it was very tricky for association health plans in the sense you had so many companies coming and going and basically getting competitive quotes every year, and healthy groups would leave, which left bad pool of health risk. And so on a self-insured policy, some of those didn't make it very long. It also the association health plans with the recent, it's not recent, a year ago when the Trump administration put out the executive order to allow the expansion of association health plans. One of the areas around that thinking is that they, by pooling together, could avoid some of the rules in relation to the Affordable Care Act and some of the, for instance, mandatory benefits that small employers have to add in their plan, where large employers have a lot more flexibility to that. And it really was designed to have a kind of level the playing field for all of the small employers so that they could band together and really negotiate better rates from a health perspective. And they've been around for a while. There's been a lot of organizations that have associations that have health plan offerings. They have morphed, I've said, over time. Most that I'm aware of, and I'm not an expert, as I said, in the legal aspect of association health plans, is Most are done in trade associations, so you have a group of manufacturers that do the very same thing. So they maybe are tool and die, or maybe they're a construction in a particular construction area and they pool together. So they're getting together for the purpose of things beyond just providing benefits. They would get other benefits from, or other benefits, it's kind of redundant, but sorry, things, value from being a part of the association. So they can go to association events, they can learn about their industry, they can maybe pool together for purchasing power for supplies or what have you. So it wasn't just for the circumstance of getting insurance. So a year ago, kind of when the administration said we're going to expand the use of, or the ability to use association health plans, they kind of expanded the definition of an employer. And so what it was from a small business perspective, I think it was a intriguing new development. So the question is, could a group of associated businesses, so not a trade association where we're all tool and die, or we're all a certain manufacturer, or we're all a school group or something like that, get together and buy insurance and get some buying power there. It expanded the definition of that to allow basically anyone in any geographic area or any group that you belong to. So people were pretty happy about that. And so a lot of new association health plans got started over the past year, and I think grew probably somewhat quickly. So unfortunately, or fortunately, whatever perspective you have, is in, I think it was March of this year, the ruling came through. There were several lawsuits that said you can't do this, and a ruling came through that prohibited the expanded definition of who that employer is. So, and you couldn't, it basically says an association health plan can't be put together with a band of unassociated businesses for the sole purpose of providing benefits. And there's several reasons why. Judge Bates was the judge who made the ruling. One, he basically said that you've overreached in your definition of who the employer is, and there could be conflicts with legal standing as far as ERISA goes. In particular, they talked about sole proprietors. Sole proprietors are, if I had a business, I was a gardener. I just go out and I garden for a living by myself. No one works for me. I might have my children work for me, but basically I'm the sole person. In the definition under having an association health plan, there has to be a commonality of people together. And so the new rules that went out, there was some judgment as to whether they were creating an employment status with the association. And as a sole employer, from an IRS tax perspective, I'm treated differently than if I were an employee. And so there's a lot of questions, again, that come up in relation to, are you really an employee or are you a sole proprietor? And there's lots of tax implications to that. And as you can imagine, the state and federal and local governments are pretty particular in regards to what your status is, because some states have income tax on corporations, some don't have income tax on corporations, some cities do, some localities do across the nation, etc. So everyone gets a little bit particular about what your employment status is. And he ruled that the intent is for sole proprietors or you're self-employed, you don't have to comply and you don't have the burdens of ERISA because you don't have employees. And by coming into an association health plan, that could put that stipulation in jeopardy and cause lots of problems. The other thing is he took issue with is by banding together of non-related businesses. One, you don't have employment commonality. Two is the issue that he believed that it was an end around to get rid of the ACA, the Affordable Care Act, and some of those provisions that I talked about. And large groups, as I said, don't have to comply with all of the same rules as far as essential benefits that a small group does. So if you're banding together in an association health plan with a wide definition of who the employer is, you could be putting yourself into a position where you don't have those essential coverage. And he basically said because there's no commonality in employment, that you are standalone and you're just avoiding or being in violation of not having those essential benefits if you're an employer under, I believe it's 50 or so at this point. Anyway, so what is the short-term and kind of long-term impact on that ruling? I think it's somewhat unclear. Those of us who've been in the insurance business or in human resources or even anybody who's had insurance has known the ACA, the Affordable Care Act, has been a big undertaking. So when it first was passed, it took a long time for all of the provisions to be defined, some of which are still being challenged, and like anything can be pretty confusing. So I think the same thing, if this is my personal opinion, the same thing in relation to these association health plans. So it remains somewhat unclear of whether they're going to be able to expand the use of associated health plans or not. But right now, I think what people have to think about is if you joined a new associated health plan within the last 12 months, it definitely, from the last ruling that came out from Judge Bates, has put you on notice to say you cannot be a part of the associated health plan that you're in, due to the fact of these things. One, there is no employer relationship for you to be pooled as a large group. Two, you are not exempt from offering those essential health benefits, so be kind of wary that your plan that you have, make sure you have those essential benefits in them. And likely a lot of them don't, because some of those benefits is what drives the cost up. And so if you're pooling people together, these associations probably didn't add all of those essential benefits because they weren't required to, so they could get better pricing in the marketplace. And three would be on the pricing in relation to the associated health plans. Small groups, as we know, can't have pre-existing conditions in their screening, as well as they generally are rated from a perspective on the demographics of their group in the industry that they're in. So it's really hard if you're in an association health plan that is heterogeneous in the sense of lots of different people, in the sense of lots of different industries. So we could have a group, instead of having a homogeneous group, which would be like those contractors that I talked about. The heterogeneous would be just anybody under a certain size can join the group. There are different industries that have different health risk factors. People in less sedentary work tend to have higher issues in relation to obesity, diabetic, etc., than people that are in very active types of work environments. So by pulling lots of different people together, it's very difficult to have a predictability on what your healthcare cost is going to be in the future, and even is right now. So it's pretty risky, in my opinion, to have an association health plan that is heterogeneous with just small employers. It's very difficult to underwrite and make sure that you have a stable plan moving forward. Let's see. So what do small businesses need to think about? I think they need to think about, if they're a part of a associated health plan today, they should ask the question of, are they in an industry group or has this associated health plan been in existence prior to 2018? Likely, if it's prior to 2018 and things haven't changed in the plan that you're on, plan design that you're on, you're probably safe, because the association health plans that were enacted prior to 2018 had a much tighter definition of how they could be qualified to be an associated health plan. If it's a new plan, my recommendation would be to get with your ERISA attorney and have them give you an opinion of whether your plan is going to be in compliance with ACA. Because I would recommend, if you are an association health plan, you possibly could still get benefits from a financial perspective, cost savings, but you should make sure that if you, as a standalone employer, are required to have those essential benefits, that I would recommend that you probably have make sure that those essential benefits are in your plan. So if you were ever audited, if the association were ever audited, you would be safe. So definitely review your plan, talk to an attorney. We'd be happy to take a look at it if you want. Again, prefaced by, we do not have in-house counsel. We have external counsel. So we aren't going to give you a legal opinion. We're just going to give you a little bit of business consulting along the way. So, but there are other options. And what I'm here to talk about today is about the other option for an associated health plan would be to talk about a professional employer organization. So the history of a professional employer organization is we've been in industry for well over 30, 40 years. And it does some of the same things in concept that an association health plan does, but it makes one really big, definite difference. In the PEO, or the Professional Employer Organization contract, every employer is in what's called a co-employment agreement. So there is an employee-employer arrangement with the PEO. So the PEO is the employer of record. And in fact, the federal government has set some pretty clear guidelines as far as who's responsible for payment of wages, who's responsible for taxes, who's responsible for different coverages. And it's very clear under the regulations that are out there now that if you're in a co-employment, provided your contract is written properly, the professional employer organization, such as Axios, is the employer of record. And so we've established an employer-employee relationship. So how does that help for benefits? Well, and how is that different, again, from the association health plans? As being the employer, we can pool all of our clients together under one census, under one common policy, and we can take it to market to be a large group plan because we are the employer of record. As I said, in the association health plans, the association is not the employer of record. Each employer in the association is a separate employer. They file separate employment taxes for each of their organization, and if they different requirements under ERISA and taxations. They have to do those things all separately, which becomes where is the rub for the federal government on the association health plans, right? So there isn't an employer relationship, and it's a lot of small companies that either are sole proprietors. Some don't even file corporate income tax returns. They are a sole proprietor and they file their own personal income tax, single business, self-employed return, which is basically your own. So there's lots of things. So how can a professional employer, so it works in concept just like the associated health plan, where we go out from an HR perspective and we talk to small businesses, generally under 100 employees, who don't have human resource departments, who have to manage employee payroll, workers' comp, benefit, employee relations, legal compliance, all of that type of thing separately. And we pool all of those people together, and we have a human resource team that goes out and delivers that human resource service to that company. We become co-employed. So Axios HR is a professional employer organization. There are many others out there. I'll talk about us today. I don't mean to be biased and just know our company inside and out. That we pool everybody together to get purchasing power. Not only purchasing power from a benefit perspective, but also purchasing power from workers' compensation insurance perspective and technology perspective. So we've made a lot of investment as an organization into our technology platform, into feeds directly to our benefit carriers, and to ease administration. So we pass those benefits on out to the clients who do business with us. And by doing so, we create that employment relationship, and then we can offer our employee benefits on a large group scale. We can also do underwriting. So we do underwriting for all new clients coming in. We want to make sure that we screen people for organizations. Number one, are they focused on employee well-being and culture and performance, or are they focused just on bottom dollar? We want people who are focused on the employees and their culture, and they want to bring Fortune 500, 100 benefits to the table, and administration from an HR perspective, so they can attract, retain, and develop top-notch employees. Small businesses, as we know, outnumbers the number of large businesses, but we're competing for the very same employee base, right? So if we want to compete against Google, if we want to compete against Apple, or we want to compete against whoever else that's a large company, as a small business, we need to be able to offer a great culture, focus, a wonderful compensation plan, right? Everybody needs to be compensated well, but we also need to have a really wonderful benefit plan. So in a PEO, you can offer that. And again, how people often ask me, how can you do that versus having an association health plan? I say because of that whole situation of being the employer of record. We don't take over anything in relation to managing our client's business. They manage their business. They take care of it strategically. We just take care of the administrative piece. So as I said, we've put a lot of time and effort and investment in our technology. We have one platform that has employee access, has employer access. It has electronic onboarding. It has time and attendance. Everything flows into one system. Small businesses can't get that on their own. Or if they can, they're having to bolt on other things in relation to it, like their benefit provider. They may not have an electronic benefit enrollment. They maybe have to fill out paper, or they do it electronically because the employee can do it electronically, but when they have to feed it to their benefit carrier, it still needs to be done manually. They need to have someone enter it into the carrier's website. Ours is all seamless, and it's all done electronic. So we focus on a few things. One is bringing strategic plan management to the table. We offer 6 different benefit types, and in general, companies pick 2 of the benefits because you do get to a point where if you're offering too many, employees maybe get just too confused. But they can offer, for small businesses, which generally they can't in their own on a small business perspective, they can offer choice. They can offer a broader sense of employee benefits, so not just medical, but dental, vision, short-term, long-term disability, life insurance. We even have pet insurance if you have pets and you want to buy pet insurance. We have legal insurance, etc., that employees can buy. And we're able to do that because of our size and the amount of employers that we kind of pool together. I always liken it to a co-op. So come to the co-op. Let us do your HR administration. We do it really well. We do it seamlessly. We can control costs that way. We have a large group of employees together in payroll to get buying power. So it's really a great thing. The other things that we do that come along with being in the co-employment is not only just the benefits. I always tell people, if you just want to lower your cost of benefits, you're not going to use a PEO. If you want to make sure that your employees are taken care of, administration is seamless, you don't have to spend your time and energy as an employer doing all of these things, then you might want to consider outsourcing your HR, because it definitely is more efficient, likely can save you money. It definitely gives you all the compliance support that you need. In fact, the professional employer organization, because of that legal employment, becomes legally responsible if something goes wrong. They're the ones that are going to be on the hook. I said earlier, we don't have in-house counsel. We have external counsel. I always tell my attorney, I love you, but I never want to use you. So we always make sure that we're trying to be proactive and that we set things up properly. But if something happens, we get challenged, something comes up, we definitely have an attorney that we work with. And because we're liable, we're responsible for any mistakes that are made, whether that's in ERISA, whether that's in FMLA, whether that's in employment taxes, etc. We're the ones that are responsible. Another huge piece is the administration of employee benefits. As I said, I always compare ourselves to a Fortune 100 HR department. We have every single piece of HR expertise in-house that small businesses can take advantage of by working with our organization. So we have an HRIS system that does electronic benefit enrollment. It also is electronic to the carriers. Employees can see all of their information online, not even just related to employee benefits, but also on paid time off, policies, procedures, all of that type of thing. We do have the large group buying power. I talked about our technology and our shared liability with our clients. So it's really just something to think about, as it's still up in the air about what's going to really happen with the associated health plans, particularly that in those that were put together after 2018. But you should take a look at it. Talk to your attorney, talk to your CPA for any tax compliance, your broker for insurances, though there is a big difference in our organization. We don't sell insurance. We are a human resource company that provides expert human resource services, relieves all the administrative burden for employing people, can bring strategic HR to the table from a recruiting perspective or compensation perspective or whatever you need. But it's different. We don't sell standalone insurance. We sell human resource outsourcing. And one of the benefits that small businesses can get, I call it the icing on top of the cake, is that you can potentially save some money and or have very much more predictable increases in healthcare over time than if you're on a standalone basis. I always tell people that I don't believe that healthcare at this point, until we really drastically change the way people look at it, healthcare costs are going to dramatically come down. We heard that they would with the implementation of the ACA, and that clearly didn't happen. I mean, ever since I've been in business, we've seen anywhere between a flat, and that's a few years, of a flat increase upwards of 10, 15, and possibly 20% increases as we grew as a small business. What we hope to do is we hope to stabilize that amount so that you don't have the big swings where you have a flat one this year, next year you have a 30% increase, the next year you have 15%, and then it goes up to 20, etc. Potentially we can get more. Ours, we've been fortunate, have been trending right at probably what the national average increases from a purely medical perspective has been. A few facts about the PE. Small businesses in a PEO are 50% less likely to close. So our strategic opinion is that if we can help small businesses lower their cost of operating from an administrative perspective, from a compliance perspective, and from a pure cost perspective, they're going to have a more likelihood to stay in business. We can help reduce employee turnover, and nationally that has been published to decrease it about 14%. That's really because they are able to now offer. People want to work for small businesses. They want to have interaction with the owners of businesses. And when you get into large companies like Apple, Google, IBM, whoever, you don't meet those people. You may read about them, you may see them at a conference or something, but you don't meet those people. So people really do like working for small businesses, but sometimes because of the lack of ability to offer a strong benefit package, the employee has to make a different decision for their family. So we're trying to give people an opportunity to have a different option, that they can work in a small company, great culture, and bring Fortune 100 benefits to the table. So it's really great. It also, we reduce nationally, it's PEO reduces employment costs by $700 per employee, and 97% of the business owners who are in a PEO would recommend it because it saved them time, it saved them headaches. I say, what's the saying? Happy wife, happy life. Happy employees, happy employer, happy life. So it's just something to consider.